Hello, my name's Simon Kennon and I'm a cardiologist in the NHS. I work at the London Chest Hospital, which is part of Barts and the London NHS Trust, and privately I work here at the London Independent Hospital. I spend most of my time treating patients with aortic stenosis, which is a condition where one of the heart valves becomes thickened and stiff and doesn't open properly. So if one thinks about the heart as a bag of muscle that contracts to squeeze blood around the body, at the top of the heart there's a valve called the aortic valve, and this valve opens to let the blood out and then closes to prevent the blood leaking back in. In an aortic stenosis, what happens is that instead of opening like that, the valve progressively stiffens until it's hardly opening at all. And at that stage the patient starts to experience shortness of breath, chest pain, and sometimes dizziness and collapse. Obviously, aortic stenosis is a mechanical problem and it therefore requires a mechanical solution. And there is a tried and tested solution in the form of aortic valve replacement surgery. This is open heart surgery where the chest is opened, patient goes on a heart-lung bypass machine, the valve is cut out and a new valve stitched on, chest closed, and then the patient woken up in ITU. And this is, as I say, a tried and tested operation, the gold standard operation, but it is quite a big operation, and the risks of this operation increase with age, with frailty, and with other medical problems such as emphysema, renal impairment in people whose heart function is weak, and in people who've previously had strokes. And in such people as that, there is a new procedure called Tavi, or transcatheter aortic valve implantation, where the aortic valve can be replaced via a tube that is placed into the artery at the top of the right leg. So a tube is placed in there, passed halfway up the main artery in the body, and then a wire can be passed through that tube across the aortic valve, and then a new valve can be passed along that wire into place across the old valve, and the new prosthetic valve, which is generally made of cow tissue, is crimped down onto a balloon, and when it's in position the balloon is blown up, pushing the old stenosed valve to one side and leaving the new replaced valve in its place. And this has a procedure that's now been done for the last 5 years and commonly done for the last 2 or 3 years. And the great advantage of it is that whereas people undergoing conventional aortic valve replacement surgery would expect to be in ITU for 24 to 48 hours and then in hospital for perhaps 7 to 10 days, in people undergoing transcatheter aortic valve implantation, they're generally only in intensive care for 3 or 4 hours and in hospital for 4 or 5 days. Following the procedure, patients generally go home and are able to start returning to their normal life very quickly. They generally go on to 2 tablets that thin the blood out, one called aspirin and one called clopidogrel, but there is no need for warfarin. And we find that a lot of patients do exceptionally well with this procedure and are very happy with the outcome. And it's always very rewarding to see people again 2 or 3 months later when they're back out doing all the things they want to do.